Today we're talking about how high is too high for blood pressure. If you want to protect your heart, your brain, and your independence as you get older, you have to understand what your blood pressure numbers really mean. But here's the problem. Most people, especially older adults, have no idea which numbers should concern them. Some are told that's normal for your age. Others are told we should probably add another medication. And many people are left wondering, is this number dangerous or not? I'm Dr. Mitch Rice, a practicing board-certified family medicine physician, and in today's video, I'm gonna walk you through exactly how high is too high for blood pressure, and a small hint, it's probably not the number you're thinking, which numbers you should be focusing on, especially after the age of 60, and how to know when your readings deserve action, not panic. Now, one of the most common things that I hear all the time in my exam room sounds like this. My other doctor says my blood pressure is too high and wants to add another medication, but I don't feel bad, and honestly, I'm not sure it's really necessary. And I totally understand that hesitation, because the truth is, blood pressure is not black and white, especially as you get older. For years, medicine has sent very mixed messages. At one point, doctors were taught a rule that said normal systolic blood pressure is 100 plus your age. So an 80-year-old with a blood pressure of 180 over 90 was once told that's normal. And we now know that thinking went a little bit too far. But the opposite extreme, treating every mildly high number aggressively, isn't right either. To understand why, we need to slow down a little bit and talk about what the numbers really mean and how blood pressure actually behaves in real life. Every blood pressure reading has two numbers, and they measure two different moments in time. The top number is the systolic blood pressure, and this is the pressure in your arteries when your heart squeezes. It's the peak pressure. Think of it like a wave hitting the shoreline. As we age, arteries naturally become a little stiffer, so it's very common and often normal for the top number to rise somewhat over time. The bottom number is the diastolic reading, and this is the pressure when the heart relaxes in between heartbeats. It reflects the steady background pressure in your blood vessels. This number is more about constant tension. Both numbers matter, but they don't mean the same thing, and they don't actually behave the same way. Let's use this information to break down which numbers are too high. Starting with the systolic blood pressure, a systolic pressure below 120 is optimal, but not always attainable. 120 to 129 is very acceptable. 130 to 139 is often reasonable in older adults, but only if you feel well. 140 to 149 needs attention, but not always medication. And 150 plus constantly at rest. Now, this is something we have to take seriously. A systolic pressure in the 130s or even low 140s, especially in someone over 60 who feels well and is active, is not an emergency. What matters is how often, how high, and under what conditions do we see these readings. Flipping to the other side, talking about the diastolic readings, anything below 80 is often ideal. 80 to 85 is very common and usually fine. 85 to 89, I want to watch your blood pressure patterns over time. And a diastolic pressure 90 plus at rest, this deserves attention. A diastolic number that stays elevated at rest puts constant pressure on those arteries. So consistently having numbers 150 plus systolic and 90 plus diastolic, this is what I consider to be too high in most people. But the important part, and most people miss this, is that these blood pressure readings must be taken and seen at rest. The only way you can truly tell if your blood pressure numbers are too high is if you get accurate, consistent readings at rest over a long period of time, which is weeks. If you see 150 systolic consistently in the middle of the day and you're stressed or walking or you were rushed trying to do something, that is not your true blood pressure. This is your reactive blood pressure. The timing and how you measure your blood pressure matters. Now, before before you measure your blood pressure every single time, I want you to do the following things. First, sit quietly for 5 full minutes. Put your feet flat on the floor, have your back supported, your arm at heart level, without talking, and having a completely empty bladder. You want to take 2 readings 1 minute apart, then take the lower of the 2 readings and write that down. By the way, it's absolutely essential to have a reliable upper arm blood pressure cuff. And let's be honest, there's not a lot of blood pressure cuffs out there that give you that consistency over time. And after researching and testing dozens of different blood pressure cuffs, I found one that works best for most of my patients. And if you want to check it out on Amazon, I'll link it in the description below. You want to do this checklist every time about 20 minutes after you wake up and the last thing you do before bed. This way, you'll get 2 readings that you write down every single day. I would check both right and left arms at different times. So one day do your right arm and one day do your left. Do this for a week, average those 14 numbers, and that is your true baseline. If this number is consistently greater than 150 over greater than 90, that is certainly too high if you're over the age of 60 in particular. These numbers come down a bit if you're younger, say in your 20s, 30s, or 40s, and you shouldn't see a systolic above 140 or a diastolic above 85. Now, why am I making such a big deal at checking your blood pressure at these specific times of the day? Well, the answer is your blood pressure constantly ebbs and flows based on the circumstances of the day. Now, this point is huge, so please hear me out. Blood pressure is not a fixed number. It naturally goes up and down throughout the day, sometimes by 20 to 40 points. This is normal physiology, not disease. Blood pressure rises with movement, stress, pain, excitement, caffeine, cold weather, or just talking, and blood pressure will naturally fall with rest, sleep, calm breathing, warmth, and relaxation. This is why a reading of 145 at noon and 126 later in the evening can both be normal. The important point is this: we do not treat single spikes, we treat patterns. I myself have a resting blood pressure around 120 over 80, but if I was chasing my dog around the house and subsequently stubbed my toe, my blood pressure would rise to 150 systolic, and that is completely normal. Hopefully this information makes sense as to why I normally pause before I just add medication, especially in older patients. I tend to slow way down before adding another pill if blood pressure only rises during stress, if readings are normal at home, if numbers drop with rest, if the person feels well overall, if there's a fall risk, or if there's dizziness present at baseline. In these cases, lifestyle, sleep, nervous system tone, and movement often help more than medication. Now, in addition to systolic pressures being greater than 150 and diastolic pressures being greater than 90, there are a few more instances in which I become more concerned and I would consider blood pressure being too high. If blood pressure doesn't come down after exercise and there's delayed blood pressure recovery, if there's kidney disease, if there's a prior stroke or heart disease present, or if there are symptoms like chest pain, shortness of breath, or visual changes, this is when I lower my threshold for considering what the numbers are too high, because the bottom line is I'm treating the person in front of me, not just the numbers. One last point, and this is absolutely critical: if you have a resting blood pressure in the 140s over 80s, but you're consistently experiencing shortness of breath, you're getting winded more easily than you used to, you're having chest pain, or you're just feeling consistently off, this is a time to get checked out sooner rather than later, and you shouldn't push it off just because the numbers are in a certain range. So if you don't remember anything else from this video, I want you to remember this: blood pressure moves throughout the day, and that's normal. Measure your blood pressure at rest. Look for patterns and don't panic if a few numbers are high. Not every elevated reading needs medication. Some numbers are too high, but many are just signals, not emergencies. Understanding your blood pressure gives you more control and not fear. And honestly, that's the #1 goal. If you found this video helpful and want a complete step-by-step guide on how to lower your blood pressure naturally by up up to 30 points in just 90 days, check out my blood pressure reset guide. I'll link it in the description below. Now that you know which blood pressure numbers are too high and how to check your numbers consistently, you're gonna wanna figure out a strategy on how to lower your blood pressure naturally. I did a video talking about how you can do this in just 10 minutes a day, and you're gonna wanna check out that video right here.